name is Garces, and she's my dentist, and I'll be interviewing her today.
Hello, Brandon. How are you today?
Good.
I am very excited. I'm looking forward to your questions.
Well, I am too, so great. What do you do?
I am a dentist. I take care of children's and adults' teeth. I treat people's mouth and teeth.
How many times do you have to wash your hands?
I gotta wash my hands quite a bit, pretty much about 30 times a day. In between patients, I always have to wash my hands to make sure I don't contaminate my patients, that I don't bring germs from one patient to the next. And of course, I always wash my hands before I eat as well.
Do you have an assistant?
I do. I have a wonderful assistant. Her name is Rena, and she is such a key player to my team. She really helps me do the treatment that I need to do with my patients, and she helps keep the patients relaxed as well.
Do you wear regular clothes?
For working, I wear scrubs, and what I have on tonight is scrubs. They are very light, the material is very light, and it helps me move from room to room and treat patients in a comfortable way. My job is very physical, and I'm like over people a lot, so I gotta make sure I am never wearing anything tight and always very comfortable.
How do you help your community?
I help my community by treating people who don't have dental insurance and who are struggling financially for a very reduced fee. Every Friday at my office, I do a community day where I treat all my patients, mainly immigrant workers, for 50% off. And these are my busiest days at the office because there's quite a bit of a need in the Philadelphia area. A lot of immigrant workers have a lot of dental issues, so a lot of people come to my office during that day, and we do a wonderful, it's a great day at the office. So I enjoy it.
How long do you work each day?
I work about 8 to 9 hours a day, Tuesday through Friday. And not only seeing patients, but also, since I am a business owner, I also have to take care of some of the administrative work after patients leave the office. But I have a good team, so they help me a lot with this work.
Do you have a specialty?
I am considered a general dentist, so my work is pretty much, I specialize on doing all different type of restorative work on children and adults. So a specialist usually focuses on doing only one thing. Let's say a root canal specialist only does root canals. An oral surgeon only takes out teeth. A pediatric dentist only treats children. I actually do all those things. So the beauty about my work and what I do is I never get bored, because I could do many different procedures on different type of patients. So that's why I love my job so much. So I never decided to be a specialist. I prefer to be a general restorative dentist.
How do you do your job?
My job is very complex. It will take a long time for me to explain all the procedures that I do, but pretty much I'm always very calm. I surround myself with a good team to make the patient feel comfortable. We are very gentle, and we love what we do. And our job is pretty much make sure everyone's mouth is healthy. And we do a lot of preventive work at our office. We teach people about nutrition, about good diet, and also about properly oral hygiene as well.
What are the different parts?
So as a business owner, I have to make sure that I do administrative work. I also do treatment of patients, and I enjoy all parts of my job. So pretty much my job is very hands-on when I'm with patients, and I just have to make sure that everything goes smoothly from the time the patient goes in to the time the patient goes out of the office.
What do you use to do your job?
I use a lot of different instruments, and it would take me a very long time to describe all of them to you, but pretty much I use the ones that are most common that people know about are the dental drills, which we call a handpiece, and what it does is it's a little drill. For children we call it the tooth whistler, and it just spins around really fast, and it shoots a lot of water. And with this I could remove the cavities on people's teeth, and then I use a special material that goes into the tooth soft, and we put a special light that makes it hard after it's nicely shaped. So this is just an example of what I use to do fillings. But there's many different procedures that I do in my office. I do dentures, I do root canals, I do extractions, and every procedure has a different set of instruments. So I need these instruments in order to do my job properly, as well as my assistant too.
So this was my dentist, Dr. Beatrice Garces, and I hope you guys like my video.
Thank you, Brandon, so much for interviewing me, and thank you to TPS for allowing Brandon to do this interview. I think he did a really good job. So.